Well, hi, my name's Dave Nykanen. I'm a pediatric interventional cardiologist, and I'm the chief of the Children's Heart Institute. Of course, it's a tragedy when somebody has a sudden event at a baseball game, a football game, and that type of thing. That's a very small amount of the population, though, and I think that the most important part of screening is seeing your primary on a regular basis, being asked by your primary about congenital heart disease in the family or any incidents of sudden death or heart rhythm disturbances, and also making sure that you have those yearly visits with your primary and your sports screening physicals. I think that's probably the most important part of screening that can be done, particularly for older children with congenital heart disease. Every newborn who's born in a hospital for sure has a test before they go home to determine if they might be at risk for having a severe form of congenital heart disease. If we're talking about outpatients that are referred to us from the general pediatric community, older patients, then those patients often have worrisome complaints like having heart murmurs that a pediatrician has noted and thinks it may be something a little bit more unusual than just the normal sound of blood moving through the heart. Some patients have episodes of fainting where they've been seen in an emergency room or seen in their primary office. Other patients may have chest pain that comes and goes. Many people also experience palpitations and that type of thing. So those are the common outpatient things that we see that are usually, fortunately, often are not that pathologic, but need some reassurance and some investigation. On the other end of the spectrum, we see patients who were born with congenital heart disease or who may have structural heart problems. And that's a very different practice in the hospital than in the outpatient setting. So we follow those patients after they've had their treatments in our clinics and on an ongoing basis. And then we have our patients who are just referred for us for evaluation.